this will also be saved and archived to our site. So we just like to start out with a brief little intro of who we are. We are the North Dakota Brain Injury Network. Our website is ndbin.org and our phone number is down below. We are considered the resource center for brain injury for the state of North Dakota. So if you or caregivers or providers or anyone ever need any help, just let us know. In 2019, legislation was passed in North Dakota to allow us to be inclusive of all kinds of brain injury. And so we have been partnering with the North Dakota Stroke and Heart Association and collaborating with them on events such as this. So they are partnering with us to make these happen. Please let me know if you have any topics or speaker suggestions. There is my contact information there, or you can find that all on our website too. So we are excited to have today's presenter is Erica Reiner with us. She's from the Department of Human Services, Aging Services Division, and they have some new services we asked her to come and talk about with us. So we are going to let her take over. And so Erica, if you just hit share screen down along the bottom of your,
okay,
and your
I have,
presentation should pop up for everyone.
okay, share screen, and I'll get my, all right, can you see my screen?
We can, yes.
Okay, good. All right, so let me get in presenter mode here. All right, okay. All right, well, thank you.
Yes.
Okay, so good afternoon. As Carly said, my name is Erica Reiner. I am a nurse administrator for the Aging Services Division through the North Dakota Department of Human Services. I just recently started there probably about a month and a half ago. Today, I'm going to speak a little bit about our home and community-based services programs, just a brief overview of kind of what we do as a division of aging services, and then I will go into our new programs, what's being offered, and then how to become a provider for those programs. So the overall, this is kind of like the high umbrella Department of Human Services, what our overall, here, I can see if I can get rid of that, what our overall mission is. And so that's to provide quality, efficient, and effective human services which improve the lives of people. So the focus of the Human Services Department is obviously on the people and providing services to them. Quality services, the principles for that, services and care should be provided as close to home as possible. We want to maximize each person's independence and autonomy, preserve the dignity of all individuals, and respect constitutional and civil rights. These services should be provided consistently across service areas to help promote equity of access and citizen focus of delivery. The service for a given cost, the number served at a service level aligned to need. Investments and funding in the department should maximize a return on investment for the most vulnerable through safety net services, not support economic developmental goals. They should be cost effective. And as far as effective services, they should help vulnerable North Dakotans of all ages maintain or enhance quality of life. So we want to support access to those social determinants of health, economic stability, housing, education, food, community, and healthcare, those basic needs. And then mitigating threats to quality of life, such as lack of financial resources, emotional crises, disabling conditions, or inability to protect oneself. So we deal with some of those difficult situations. For the Aging Services Division, our overall purpose is to administer home and community-based services that allow older adults and individuals with physical disabilities to remain in their own homes and communities. We protect the health, safety, welfare, and rights of residents of long-term care settings and vulnerable adults in the community. So all of the services kind of focus around that purpose. Our core functions for the Aging Services Division.
Do you try to hit record from your end? It's not letting me from my end. And so I just want to make sure we're getting this recorded for people.
Sure. Let's see here. Is it, you can see my screen, right? Is it down on the bottom?
Down usually right next to the where it says share screen.
Okay, let's see, new share, pause, start video. Let's see. Here, recording to the cloud, it says.
Yes.
Yeah, Carly, it says it's recording.
It does. Okay. Okay.
Hopefully, anyway.
Okay. Sorry.
No, that's okay. Got it. Okay. All right. So our core functions. So see, these are some of the services that the Aging Services Division administers. So the Older Americans Act services, many of you are probably familiar with these. These are the services that are provided for like congregate and home delivered meals. So we contract with local providers for supportive and nutrition services. So like your senior centers throughout the state that provide those services, as well as helps to support family caregivers through the Family Caregiver Support Program and then the Lifespan Respite Grant. We also provide direct services through this division. The Aging and Disability Resource Link, some of you are probably familiar with, and we'll talk about a little later in the presentation as well. And then the Family Caregiver Support Program. We have case managers throughout the state that help with this program and connect family caregivers with available resources throughout the state. And then the long-term care ombudsman services, which provide consultation and regular site visits and help investigate complaints in long-term care. And then also the vulnerable adult protective services, which many of you are also probably very familiar with and have maybe filed reports in the past. But this, obviously, the overall goal is to safeguard the rights, safety, well-being of vulnerable adults in our community. And then we also administer state and federally funded home and community-based services. So those programs we'll go through a little bit briefly here. Our SPED, XSPED, Medicaid waiver, technology dependent waiver, and then the MSP, so Medicaid state plan programs. And then also under the Aging Services Division now is the supervision and training to home and community-based service case managers. So that's kind of the overall functions. So home and community-based services, there are both state and federal dollars that help to pay for these services if the client meets both functional and the financial eligibility. So primarily these services serve our older individuals, as we talked about before, and those with physical disability. Your SPED program, our service payments for elderly and disabled, that one is a program under which quality service providers are reimbursed to provide certain services and designed to help the individual remain in their home, like all of the programs really. XSPED is a program which pays for in-home and community services for people who would otherwise receive care in a basic care facility. And then our Medicaid waiver, 1915 C waivers for the aged and disabled. This one enables the state to deliver services under a waiver of several Medicaid requirements, services to aged and disabled who would otherwise be at risk of institutionalization. And then our tech-dependent med waiver, that one was for ventilator-dependent clients. So this next slide here, home and community-based services, gives you the whole array of all of the services that fall under those programs. So adult daycare, foster care, residential care, memory care, attendant care. And I know you can read through some of these. Emergency response system, our family home care and family personal care. So sometimes individuals might have a family member that can be paid to care for them. That falls under these services. Home delivered meals, homemaker services, non-medical transportation, personal care and respite. We have supervision, supported employment, and specialized equipment and transitional care. So all of those pieces fall under those programs. So benefits to home and community-based services, I feel like oftentimes are kind of obvious. One of the big things that sticks out is, it's often the preferred choice of care for for individuals. They want to be in their homes. They want to be in a setting that is least restrictive, which these home and community-based services, one of the benefits is assisting in meeting our Olmsted requirement of the most integrated setting. So that requirement, the Americans with Disabilities Act requires public agencies to eliminate any unnecessary segregations of persons with disabilities and to provide services in the most integrated setting appropriate to the individual. So like we said, that's often what people desire and want, and we hope to delay institutional placement with those services too, if that's the choice of the individual, and it's also cost effective. The continuum of care, this slide just kind of gives you an idea, and I think we're all familiar, you know, you've got your home-based services. Sometimes clients then, or people then move into your assisted living where you can still receive some of these home and community-based services along with basic care. And then your skilled nursing facility, that's kind of the end result. So if they're no longer able to remain in their home, but hopefully we can delay some of those steps prior to getting to that level with these services. The last legislative session allowed for more help for people to access services in their home. And so there was an increase in home and community-based investments, which is a great thing. So one of the things that came through was an update in our SPED program cost share fee schedule. So meaning it allowed for more people to qualify based on income. The income level was increased, and as well as updated the functional eligibility, so it's a little less restrictive. So more people qualify for that program and can get those services in their home. It also allowed for an expansion to our ADRL to include a centralized intake. So this is still in the works, but the goal is to have a central place for people to call to refer a person or to get connected with home and community-based services, so that everyone knows where to go and who to call. So that goal is to make a centralized intake with the ADRL site. And then this happened as well, the specialized role of the home and community-based service case managers. They're all under the Aging Services division now. And so hopefully it helps with some of the consistency and in implementing these services and getting people connected. And then the new services that came into play under the HCBS waiver program. So the Medicaid waiver allowed for the companionship, residential habilitation, and community supports. So those are some of the new programs. First, we'll talk a little bit about companionship. This one, it can be provided to an individual with a physical disability. It's non-medical care provided to someone who lives alone and maybe has no one else to provide this care. It's more companion tasks. So, maybe, you're helping them make a meal or playing cards with them, going on a walk with them, going to a community event together, those kind of things. It must have a therapeutic component tied to it, and it cannot exceed 10 hours per month. So it can be provided by both an individual or an agency quality service provider. So they have to have the cognitive endorsement on their enrollment, but it can be both individual or agency. And then the rate I included on there just because that's often a question. And so for an individual, it's $4.67 per unit, which is one unit is 15 minutes. Many of you are probably familiar with that. And then the $6.42 per unit for an agency. So an agency always has a little higher rate because of overhead costs. Then our next one was the residential habilitation. So this one also, it falls under the Medicaid waiver program, like I talked about before. And I know sometimes this is a little confusing, but with that, oh, it went forward. Why? Sorry. With that, the person needs to be Medicaid eligible, needs to meet skilled nursing facility level of care. So that's one of the big pieces. And they must have like a daily need for services and need skills training or restoration. So this one kind of sets apart when I talk about the next service, the community supports. This one is more residential habilitation. I would think of habilitation. It's focused on skills restoration. You're trying to maybe improve a skill or teach a person, you know, a certain skill again, and maybe they are teachable. Our target population would be someone with a TBI, so traumatic brain injury, stroke, or early stage dementia. Someone like that would qualify for this service. Some of the tasks can include what we say it's more all-inclusive, so adaptive skill development, some education and training, assistance with your activities of daily living and the instrumental ones as well, the IADLs, community inclusion, social and leisure skill development, personal care and homemaker, protective oversight and supervision. So those are some of the things that would be included under this service. Community supports. So both of these services, like I stated, they're the same idea. This one is more custodial and maintenance care. You still need to be, you know, Medicaid eligible and meet that skilled nursing facility level of care. You need to have that daily need for services. It's up to 24 hours per day, but not meaning it will be. And then complex medical needs, high ADL needs. And your target population, again, is someone with a physical disability and complex health needs. Both of these services are meant to mirror DD services that are already in place. They have these already, which a lot of you are also probably familiar with, but they're meant to kind of be the same idea as those. Service tasks, again, are going to be the assistance with your ADLs and your IADLs, community inclusion, some personal care, protective oversight and supervision. Some of those pieces would be included in there. So when you're taking a look at maybe a typical care plan for a client on one of these, ResHab or community supports, maybe they're getting personal care like homemaking, skills restoration, like medication management, some social integration, so there's always care coordination involved. And then this talks about the average cost. So it's a daily rate, but $30 an hour is the rate. So again, say you're doing 12 hours of care, then 30 times 12 is $360. So that'd be your daily rate for that client specifically. Residential habilitation and community supports can be provided in a couple different settings. So of course, a private home, an apartment, and then also agency adult foster care or that shared living environment. So agency adult foster care, what is it? So it's a residential home which fosters care for adults, and it's provided by professional staff. So an agency must purchase or rent a home in a residential area and be providing these services, ResHab and community support. So those services would be provided in this foster care, and it can be provided for up to 4 adults. It's licensed, so licensed home-like setting, up to 24 hours per day care, but not meant for just supervision. So, you know, you might be providing care for 12 hours of the day, but the 24 can't be just for supervision. And it's Medicaid only again. This is all under the waiver, so Medicaid only. And then your maximum monthly room and board, so the agency can charge the consumer, the person living there, the $739. That's the maximum amount. It could be less than that, but that piece is paid by the consumer, so not included in the program. So that would be the maximum amount that could be charged for that piece. The provider requirements for these services are a little bit different than the regular home and community-based services. So for ResHab, community supports, and your agency foster care, you do need to be a QSP provider, which we talked about in an agency. An individual cannot provide these services. So that sets it apart a little bit from that companionship. So it's an agency CQL accreditation, which I know some people have already. This accreditation is required to provide these services as well. And it's an accreditation where they actually do an on-site survey after a year. But initially, they want to look at your policies and procedures. They're focused, on your person-centered practices, and they focus on the individuals that you're caring for, making sure they have a positive experience. I think they do some surveys with them. There's just different components that you have to get through, and then you move to another level of it each time. So that piece would be required, and the initial cost, I said again, is $2,500 to the agency, and then the rest is covered by the department. So that would be the starter for that. And TBI modules, so that is online learning, and that's provided by the Brain Injury Network. And I would assist in connecting you to these things. So the online learning, the dementia modules too, that's another piece that's more online learning. These modules would be required to be completed by any staff that are going to be providing care to these specific clients. So the dementia modules, I would be the one to assign those as well to the people needing them. And then medication module and testing. There's also a medication module, basically like I would have to send it to you, but it has just a bunch of information that the caregivers would have to go through on medications. It's a module, and then there's a proctored test after. And then there's even a practicum as well. So that would be signed off by the licensed nurse. And this stuff can be talked about on the side. I know there'll probably be more questions related to this, and it's going to be a little bit more agency specific depending what you already have. We just kind of got some of this stuff going with our COVID stuff going on, of course, that delayed some of the trainings and getting all that purchased. So, but these will be the pieces that are required. And again, I would be the one to help hook you up to those. All home and community-based service providers must be enrolled as a QSP, and they have to be able to bill in MMIS. So this wouldn't be any provider in general. Provider requirements vary by service. They must recertify every 2 years and must contain required documentation. For all of these services, there has to be, care plans on file, and any documentation that you're seeing the client must be on file. Must participate in audits and complaint investigations, and then also must follow other provider criteria as required as well. And so I included the contact information for our aging and disability resource link, just because this is a good connector. If you do have questions with services or you need to connect with a case manager, that kind of a thing, this has the phone number. There's the link, the 1-800 number, and then the email, and then also a link for the online site too. And so, like I said before, we're willing to meet with anybody if you want to do a side phone call or email. If you have questions related to getting started. Again, it's all new, so we're kind of working on making sure all of our processes are in place, but we are needing providers. We don't have any yet. And so you can filter any questions or send them my way, and I would find out the answers if I don't know. So my phone number is listed here, and then I have my email also if anybody has more questions. So with that, I don't know if anyone has any specific questions that I can answer, I can take back if I'm unable to today. Please let me know.
Hi, Erica. This is Ashley Acker. Can you hear me?
Yeah.
I jumped in the meeting here late. I was on a call. I was just wondering if I could get a copy of the slides sent to my email at all.
Most definitely. Yes.
Okay. Thank you so much.
Yeah, I can, Carly, do you guys have all of the people on here? I mean, I can, or even if you, however you want to do the slides, do you want me to send them? I can send them out to everybody.
Sorry, I'm gonna mute myself. If you're comfortable with it, you can share the slide, or I have your slides, and we can just put them on our website along with your presentation from today. Okay, we'll do it that way. So they will be housed on our Webinar Wednesday site, or on our area under ndavin.org if you're looking for them.
That'd be perfect. Then everyone can get them that way.
Perfect.
Okay.
Thank you.
Thanks. Yeah.
Erica, could you go back over, because you went over it really quickly, but
Sorry.
No, that's fine.
Talk fast.
Under the client persona, it's slide 15 actually, if that helps you.
Sure. Yeah.
Right. So I was trying to figure out, could you walk through that again?
Sure. So this is, say, maybe a typical care plan for a client that would be on these services. So maybe they're getting, yeah, and I can see it's kind of confusing. So like personal care, maybe they're getting homemaking for their personal care piece. Skills restoration, maybe we're teaching them how to do their medications or managing their medications. Again, that could be part of the skills restoration. Social integration could include care coordination, like connecting to the physicians or maybe family members, some of those pieces, and maybe all of those hours would add up to 12. It kind of depends on, because your home and community-based service case manager is the one that's going to go in there and kind of help determine the number of hours that are needed. And so they would be the ones to help figure that piece out. So anyway, with those services listed, then say that took the 12 hours, then times $30, because that's the hourly rate. It's really paid at a daily rate, but it's $30 an hour. That person would be, so that agency, I guess I should say, would be reimbursed the $360 at the daily rate for this client, this type of a client, just depending on what services they need, how many hours.
Erica, this is Jake Reuter. I'm wondering, could you talk to the group a little bit about the care coordination piece that's required under community and the rehab services?
I'm not sure under community and rehab services.
Well, under residential habilitation and the community services, the provider has to provide care coordination.
Sure. I guess I'm not sure exactly what. Do you have information that you would share or that you know?
I just understand that part of each of those services with that higher rate that the agency will be providing
care coordination,
which is to me such a critical part of each of the services. And I know there's a lot of case management staff on, and
sure,
they just know they have a job and they have a role, but these folks are usually going to be of higher need, and that care coordination piece will really track the day-to-day success of the services. And
sure, because you're really overseeing all that care. Yes, when you're doing all-inclusive care like this, there would be care coordination. I see what you're meaning. Definitely, there would be that piece too. You're overseeing all of the care.
So when figuring out that daily rate, so then like the residential habilitation community supports, it has its own daily rate, but then in addition to that?
Sorry, Rebecca, you cut out a little bit. Can you repeat?
So if you're figuring out like the daily rate for residential habilitation, it's not a consistent rate.
No. Right. It'll depend on the number of hours that client is in need of. They need to have, it needs to be a daily need, but they may have a different number of hours, right? So it's $30 per hour and it's paid at a daily rate, but it depends on the number of hours.
Okay, and is that something that is like just based on the individual's need, but it's not like a billable service type thing? Based on their need?
Dependent on their need, yep.
Okay. And I don't know if anybody else had any questions. There was somebody in the chat that asked for everybody to make sure that they've muted their mics. Anybody else have any questions or anything? Is anybody that wants to say that they're interested in any of these services or?
Yeah, and if there's more questions, which I realize there probably will be, and there's kind of a lot, I mean, we don't have any providers. Nobody's doing this yet, so it's going to be a little bit of a learning curve at first. So when we do have a new provider, we're going to have to be working pretty closely with them to figure everything out. And Nancy, my director, she's been speaking this language for a while, so she's a great resource for me as well, since I'm fairly new. Just learning all of the pieces that go along with all of these services as well. Definitely reach out and let me know if you have more questions, or give me a phone call. I can definitely find the answers.
Yes, so and that's why I was excited to find out that Erica was in this role and to be able to have her answer some questions for us. Particularly the residential habilitation, the agency foster care has been something that we've really been working on for many years from an advocacy perspective to bring here to North Dakota. For those of you familiar with Minnesota, Minnesota does have brain injury agency foster homes, and they're ones in Crookston, Minnesota, in Moorhead, Minnesota. So they're right there. And so a lot of times, particularly in those border cities, we will have people ask, well, why can't I use the brain injury group home in Moorhead side? And explain to them that that's just not a service we have here in North Dakota. But now this is an option that we do have it as a service. So now it's just working through the kinks of actually getting a provider up and providing the service. I think for me, one of the things that's helpful for this, and will be up to providers to follow up with Erica to get more information about, is that funding piece. Really getting an understanding of, like, okay, what is the daily rate per individual? How could you set up, a model program around that? But having Erica in this position and her willingness to offer that, great. So any provider that is interested, this is that introduction piece of Erica, the person to follow up with. Any other questions or comments? No? Well, I want to thank Erica.
Yes, thank you for your time, and thank all of you for joining us.
Thank you guys so much. Yeah.
And as we said, we will have a recording of this available on our website along with the slides. So days online, but then we will have those online for anybody that wants to follow up and get the information.
Okay, that's it.
All right. Thank you.
Thank you so much, Erica. We appreciate it.
Thank you.